Good morning.
Good morning. How are you?
Good, how are you doing?
Good, thanks.
Welcome to Coffee with Katzen / Plastic Surgery 90210. What cup do you have today?
We've got Elf on the Shelf. What do you got?
Charlie Brown.
Nice. Merry Christmas.
Merry Christmas. So exciting.
Yeah.
Today we're going to be talking about breast reductions, breast lifts, and insurance coverage.
All right, sounds good.
So we talked a little bit about both last week. Let's
Yeah.
talk about the primary difference between the two.
Yeah, so with a breast lift, I'm lifting the breast. The breast is being lifted up, okay? You don't want to lift them down, right?
Right.
So you want to lift the breast up. Another word for it is a mastopexy, because we are taking the masto, the breast, and pexying it or lifting it, molding it, flexing it, bringing it back to position. So when we're talking about a mastopexy, the primary concern is where is the nipple areolar complex? Okay, there's the nipple right in the middle, ideally, and then the areola, which is the pigmented tissue around the outside. So that can be at the dome of the breast, perfect position, or it can be slightly down or at the bottom of the breast, and it can sort of be in any position thereof. It can also have asymmetry. One can be in one position, another can be in another position, but the purpose of the breast lift is to reestablish the position of the nipple areolar complex, so bringing that up on the breast. The second purpose is to remold the tissue of the breast, lifting that breast tissue up. So this is a breast lift. So this patient had lost 350 pounds and really didn't like the shape of her breast. She had lost a lot of volume of the upper pole of the breast, and she was happy with the size of the breast. She just wanted her breast lifted. So on her, I had to make an incision around the areola, down the front of the breast and underneath the breast, and lift the breast. I didn't necessarily change the volume of the breast, I just changed the position of the breast by lifting the breast up.
And if you were to change the volume, then it would be a breast lift and reduction.
No. Oh, yes, true. If we were making the breast smaller. If we were changing the volume by making the breast bigger, that'd be a breast augmentation.
Okay, a breast lift with augmentation?
Correct.
Got it.
Correct.
And here we have a breast reduction. Let's talk about this.
Yeah, so this breast reduction patient exercised a lot. That was her primary complaint problem. When she exercised a lot, the breasts would get in the way. She couldn't run well. She felt that the breasts were hampering her activity. So on her, I did a breast reduction. She didn't like the size of the breast. She felt the breasts were too large. So I did a breast reduction. So on this patient, I did an incision around the areola, down the front of the breast and underneath the breast. And you can see it's healed very well. She's very happy with the size of the breast. Now she's able to exercise and specifically run much better and much happier and much more comfortably.
And I hear a lot of patients talk about bra strap pain and how it just digs into them and causes them migraines sometimes too.
Correct. So with the large size of the breast, the weight of the breast pulls the bra down and pulls the bra strap into the shoulder. And patients can get a pinched nerve in there, the nerves that come down to the neck. That nerve can get pinched. That constant muscle tension can lead to tension headaches. And then those bra straps can, with time, eventually cause a groove in there, and you'll have a ridge of shoulder and then an indentation, actually, where the bra strap was digging in to the shoulder.
And you would think with that pain that's caused by having large breasts, it would get covered by insurance.
You'd think, but not all the time.
Let's talk about that.
Yeah, so it really depends on your insurance. So insurance coverage for breast reduction really depends on the quality of your insurance. Some insurance companies categorically say within their sign-up protocol, we do not cover breast procedures. Or they can categorically say, we do not cover breast reductions. They can put it in there, and it's up to you if you want to sign it or not. That's up to you. They don't have to cover it. I've seen in other insurance coverage that they say, we do not cover any procedures after weight loss. So if you're looking for a breast procedure after weight loss, it's not covered because that's the policy and that's what you signed up for and that's what you're paying for. So you got to read the policies very carefully, okay? But in general, okay, there's this thing called the Schnur scale, okay? It's this, Dr. Schnur invented it or wrote about it, and basically it encompasses your height, your weight, which we interpret to be your body surface area, and then we calculate how much breast tissue you need to be reduced to qualify for a breast reduction. So if you have enough breast tissue, you may or may not be covered for a breast reduction. But if you're looking for breast reduction coverage, you want to have, as you'd think, larger breast. If you have bra strap groove pain, if you have neck pain, if you have chronic headaches, if you have rashes underneath the breast, that are not treated or not cured with antifungals, antibacterial creams and lotions, etc., then you may qualify for insurance.
So that Schnur scale, is that what most insurance companies use?
Most insurance companies, yes, they do use it.
So is it proportionate to your body? So if you're a bigger person, but you have bigger breasts, then you're less likely to be covered than a smaller person with bigger breasts?
Correct.
Oh, okay. Oh, that's unfortunate because they still have the pain of it.
Correct.
And the pain of the rest of their body weight
Correct.
too. Okay.
Correct. But it makes things in proportion. Okay, so a smaller patient with larger breasts would have a higher Schnur scale, all right, because of proportionality. Larger breasts, larger patients would have a different Schnur number and then maybe less likely to be covered.
All right, and what is your advice for people out there trying to be covered?
Yeah, I would go see as many plastic surgeons as you can, all right? So you can just pull up any names of plastic surgeons in your local internet search, or you can go on the back of your insurance card, usually there's a 1-800 number or 1-888 number, call that insurance company, or maybe they have a website, and then look under plastic surgeons, and then go, okay, find a plastic surgeon that's covered under your insurance, and then go visit that plastic surgeon to see if that plastic surgeon who takes your insurance is willing to do your breast reduction under the insurance policy.
Okay. And then what about male breast reductions?
Male breast reduction, sort of a different category. The diagnosis, the condition is called gynecomastia. Basically, it's female breast on a male body, all right? So typically, by definition, the gynecomastia, there can be many different forms, but by definition, typically it's a hard nodule of breast tissue underneath the nipple areolar complex. And it can be under one breast or both breasts. Usually it's asymmetrical, usually it's one side, not both sides. But anyway, and it's a hard mass. But there can also be subvariants of it where you have a lot of fat distributed throughout the breast. So that's a different kind of gynecomastia, but nonetheless, those are conditions which need to be treated with plastic surgery. Sometimes we're cutting out that hard lump underneath the nipple areolar complex. Sometimes we're just doing liposuction. Sometimes we're doing an incision underneath the breast, taking the nipple off and putting it back as a postage stamp. Basically, it sort of really depends on the condition of the patient.
Okay, and what are the chances of that getting covered by insurance?
Depends on the insurance coverage again. If you have really good top quality insurance, more likely to get covered. If you have a sort of average, maybe 50-50 chance, if your insurance is not that good, highly unlikely.
All right, and let's talk about what affects the cost of a breast lift or breast reduction.
Yeah, so as we just talked about, insurance, obviously, so if you get insurance coverage, they're going to pay a large percentage of the operating room, a large percentage of the anesthesiologist bill, a large percentage of the surgeon's bill. If you're going out of insurance, then it really depends on the location. Are you having it in a very urban setting? Are you maybe having it in a rural setting? Are you having the procedure done in a hospital or a surgery center? Hospitals typically are much more expensive to have the procedure performed in as opposed to an outpatient surgery center. Are you doing the anesthesia with a board-certified MD doctor anesthesiologist, or are you having it done by a CRNA, certified registered nurse anesthetist? Okay. And so those are the factors that go into it.
Does length of surgery also?
Length of surgery will determine that in a surgery center. Sometimes hospital too sort of depends on the rates that you have, but typically hospitals and surgery centers charge by the 15-minute increment. So just like a taxi cab, as you're going along, the longer surgeries, they're going to cost more. The shorter surgeries, they're going to cost less.
Okay, got it. And what advice do you have for anyone out there who's considering a breast lift or breast reduction?
Yeah, consult with the plastic surgeon. You don't know what you don't know. So go consult with a plastic surgeon. If you agree with what the first plastic surgeon says, well, go with that plastic surgeon. If you don't agree, maybe get a second or third or fourth or fifth, or as many opinions as you want. Maybe even go online. There's some forums online where you submit pictures and you get an international response of plastic surgeons as to what they would advise.
And we were talking earlier a little bit about how breast lifts and reductions affect breastfeeding and nipple sensitivity? Can we talk about those things?
Correct. So with nipple sensitivity, the nerve to the nipple comes from the side of the breast. Okay, it comes from the thoracic region, the rib cage region of your back, around the side of the breast, and comes to innervate the nipple areolar complex. And with our surgical techniques, we avoid that nerve. We avoid that nerve being cut. So the majority of the time, nipple sensation is preserved. Okay, whether you're having the crescent breast lift, or maybe the donut, or maybe a lollipop, or maybe even the anchor, usually nipple sensation is preserved. Now, if you don't have nipple sensation before the surgery, it's impossible to get the nipple sensation after the surgery.
Right.
So it sort of depends also the cards were dealt. Okay. Now, in terms of breastfeeding, you've got to understand that the nipple is not just one little channel at the tip of the nipple that provides all the breast milk. There are all these little ducts and channels that come to the tip of the nipple, providing milk for the child. So it's highly unlikely that all those ducts get cut. So there's still a high possibility of you being able to breastfeed after a breast lift and or breast reduction. All right, but depending on the amount of lifting we're doing or the amount of reduction we're doing, the more lifting and the more surgery we're doing, the higher the chance of those ducts getting injured.
Okay, and so do you recommend people wait till they have all their children and they're done breastfeeding?
Yeah, so there are two sort of categories of patients. There are the weight loss patients. So for the weight loss patients, like this patient here, this patient had not had any children. So for this patient, I would suggest getting the breast surgery done earlier. Why wait in that situation? Patient has to understand, okay, she may not be able to breastfeed, but do you want to finish having kids and live with your breast like that, or have the breast surgery, have the breast lift, and maybe not be able to breastfeed? That's sort of a personal choice the patient has to go under. But typically, in general, for non-weight loss patients, we usually advise finish having your children, finish breastfeeding, then proceed with your breast lift or breast reduction.
Got it. And recovery time?
Recovery time is pretty quick. Usually it's going to be about a week to 10 days, sort of depending on your individual situation and your type of work. If your work is maybe sitting type work, you may be able to go back to work in about 10 days, 2 weeks. But if your job entails a lot of lifting, moving stuff around, maybe you're moving patients in the hospital, maybe you're lifting stuff out of a grocery cart onto a conveyor belt, things like that, maybe you should return back to work at about maybe 3 to 4 to 5 weeks.
All right, great. Well, thank you for answering all of our breast lift and breast reduction questions.
Sure.
And if anyone has questions, they could DM us on Instagram at Dr. Katzen MD, or they could give us a call.
310-859-7770.
All right, Dr. Katzen, thank you so much, and we'll see you next week.
Cheers.
Bye-bye.
See you next week. Bye.